Thank you, sir. All year long, we've talked with families left to grieve when their loved one dies of fentanyl poisoning.
The DEA's St. Louis division, which serves our area, says it's seen a record year for fentanyl seizing, more than 1 million pills taken off the streets. So special agents with the DEA tell us fentanyl is especially dangerous because it's entirely synthetic. That makes it stronger, faster, and cheaper for cartels to produce. Most of it comes into the U.S. across our southern border through vehicle transportation. Distributors are targeting victims through social media and street deals. The DEA has partnered with local law enforcement to go after distributors, manufacturers, and street dealers.
Not only does DEA benefit by augmenting, the personnel, but that also makes it easier for DEA to be out in those communities. If somebody is partnered with us, that intelligence exchange that goes on.
Special agents say prosecution depends on several things: the amount of drugs you can attribute to an individual, the complexity of the crime, prior criminal history, and the result of the crime, such as overdose or death.
But our investigations, it's not unusual for them to do in excess of 20 years for charges that we pursue them on.
The DEA also pushing for education campaigns about fentanyl with the hopes of saving lives.
KSHB 41 News reporter Jian Kim talked to a drug recovery center with the same goal. She also asked doctors to help us better understand this deadly drug.
You've likely heard of fentanyl by now.
I just miss him. Wish you never touched it.
Or the line, one pill can kill.
Our children are being deceived and being murdered.
But what really is fentanyl, and why was it created in the first place? I sat down with Dr. Adam Algren at University Health to find out.
Fentanyl is a pain medication that was designed to treat pain.
Dr. Algren says fentanyl binds to different receptors in the brain that controls pain. When used in highly regulated medical settings, it can be extremely beneficial for patients. So where's the line between helpful and deadly?
So the biggest difference is probably just that when fentanyl is manufactured for people to buy out on the street, there's no quality control there. So you really don't know how much fentanyl you're getting.
Not only does fentanyl numb physical pain, but it can have an emotionally numbing effect, which can lead to feelings of euphoria. It's highly addictive, 50 times more potent than heroin and 100 times more potent than morphine.
I would say that we're seeing multiple cases daily in our emergency department.
First Call, a local drug recovery center, says some of the biggest challenges in fighting fentanyl are lack of public knowledge, widespread misconceptions, and getting everyone to care.
I have some schools that don't want to touch it.
First Call recently got a federal harm reduction grant by the Substance Abuse and Mental Health Services Administration. It'll help expand trainings and presentations in the community.
We talk about, signs of an overdose, how to respond to it, and how to administer naloxone.
Dr. Algren says someone who is overdosing may seem sleepy or, in extreme cases, become unresponsive, have difficulty breathing, or their pupils may shrink in size.
There's going to be a spectrum.
As of this year, Narcans can be bought over the counter at pharmacies. Dr. Algren advises everyone keep one on hand.
Anytime naloxone is administered, I would call 911.
Jian Kim, KSHB 41 News.